Our next section on perinatal infections is toxoplasmosis. Toxoplasmosis is a parasitic infection, and it is carried by the cat. This happens to be Buggy. Buggy is my wife's cat. I don't particularly like Buggy, but that's a whole different story. And the only reason I have her picture here is because it is the contact with the feces of cats which is resulting in the toxoplasmosis infections in the United States. Here's our case, and it is a classical description. A 26-year-old prima gravida was admitted at 39 weeks in active labor at 6 centimeters dilation. She's at term. During her second trimester, she experienced a mononucleosis-like syndrome. Now, what's mononucleosis-like syndrome? Perhaps a little aching, a little low-grade fever, nothing major. What do you think it probably is? Well, you think it's probably just the flu. Don't think too much of that. Interestingly, the fundal growth of the uterus lagged behind that which you would expect on a first trimester ultrasound. So we know how far along she is, and the fundal growth was not what it should be. Ultrasound showed symmetrical IUGR. Remember, symmetrical IUGR is associated with aneuploidy, early first trimester infections, and gross anatomic anomalies. She delivered a 2,250 gram male neonate. Now, small for gestational age is less than 2,500 grams. So at term, this baby is clearly small for gestational age, IUGR, with, notice, microcephaly, intracranial calcifications, and chorioretinitis. When you see symmetrical IUGR, intracranial calcifications, chorioretinitis, your diagnosis is toxoplasmosis. How is it transmitted? Infected cat feces. Now, cats are clean animals. It's not petting the cat. It is handling the cat feces. Now, in European countries, particularly France, it is transmitted by raw goat milk, unpasteurized goat milk, undercooked meat. Sushi, not a problem. Cat feces in the United States. When is the time of vertical transmission? Vertical transmission means from the mom to the baby. And the time is when you have the primary parasitemia. Now, emia means bloodstream. The initial infection, the primary infection, the parasite gets into the mother's bloodstream. It infects the placenta, causes a velitis of the placenta, and crosses and then infects the fetus. The residual effect, lifelong latency or lifelong immunity. Lifelong immunity. If you're healthy and you have a good immune system, you will only get the infection once. The antibodies that you have will protect you from a recurrent infection. So if a woman has IgG antibodies against toxoplasmosis, she is protected during that pregnancy from any risk to her fetus. Lifelong immunity. And here we have a mom with her cat. It's the cat feces that we're concerned about. The lifespan, it goes in and out of the cat, and the humans are just a passive part of the system. What trimester is fetal infection the most lethal? In the first trimester. And yet, when do most toxoplasmosis infections occur? In the third trimester. How do we prevent it? Avoid contact with cat feces. Remember, first trimester, not good. And yet most occur in the third trimester. Most third trimester infections end up to be subclinical, asymptomatic. IgG antibodies will be positive, IgM antibodies positive, but you'll see no other stigmata. When you get the IUGR, intracranial calcifications, the chorioretinitis, it is usually from an early pregnancy infection. The treatment, pyrimethamine and sulfadiazine. Now, I must give you a confessional. I have never diagnosed a patient with toxoplasmosis in pregnancy. It is very rare, because most of the time it is a subclinical mononucleosis type of infection, and this is simply what I've gotten from the books. It is very uncommon, toxoplasmosis in the United States. However, the risk of fetal infection, first trimester, only 15%. Second trimester, 25%. Third trimester is the highest, but the severest in terms of bad news is first trimester. If you would remember, on the exam, you have a case of a newborn with chorioretinitis. Your diagnosis, congenital toxoplasmosis. Chorioretinitis, intracranial calcifications, symmetrical IUGR, that's congenital toxo. Now, many of these perinatal infections, you will notice, love the central nervous system. And intracranial calcifications are seen with many of these. And yet the most prominent cause is going to be toxoplasmosis. Here is chorioretinitis. This is looking at the fundus of the eye. Here we have periventricular hemorrhage and calcifications. Again, we have the periventricular calcifications. This one is very prominent on a CT scan. Here we have fetal intracranial calcifications, which are on a ultrasound. Again, severe fetal intracranial calcifications. When you see that, you should think toxoplasmosis. You can have even an obstructive hydrocephalus, and here you have enlargement of the lateral ventricles in the fetus. This fetus is infected, resulting in ascites, and you can see the acidic fluid. This is the liver on a transverse section of the abdomen. And this placenta is really thickened from intrauterine toxoplasmosis. This is one of the saddest cases I've ever seen. Look at the head. Above the orbits, there's basically no brain. Severe microcephaly from toxoplasmosis. The outcome of this baby is going to be so poor, and something which could be prevented. What percentage of women of reproductive age are IgG toxoplasmosis positive? About 40%. So most women have had exposure, and 40% already have antibodies. And that's the end of toxoplasmosis.